Hi all, this is Xoli, the midwife in private practice. Today I think let's talk about spotting in pregnancy, which is one of the most commonest and scariest thing for all moms, because once you fall pregnant, the common knowledge is that you're not supposed to be bleeding in pregnancy, and sometimes we think that even spotting is bleeding. What is normal spot? There's no spotting that is normal. Okay, there's no normal spotting. All spotting needs to be supervised and be guided and be notify the person who's taking care of you so that they can guide you as to according to the history that you're giving and the history that they know about you. What could be the reasons behind me spotting? Okay, sometimes, or not all spotting are catastrophic, not like you're gonna miscarry. You could have spotting because of the unmanaged air thrush. Okay, so, and moms that have got a lot of thrush, they can tend to be quite aggressive with each air scratching, and which leads to the bleeding. Sometimes it could be what is called implantation, which happens a lot between 9 and 11 weeks, give or take. Remember, I'm coming from a space of common. If you start spotting at 8, when you think that you're 8 or 13 weeks, it's still within that level of implantation. When now the placenta is embedding itself into the wall of the uterus and causing a little bit of corrosion on the walls of the uterus, that is what is called implantation, which tends to be an innocent pinkish discharge that you would see when you're wiping. Another reason of the spotting could be what is called postcoital bleed. If you are sexually active in the last 3 days, you could find that you're having a little bit of a bleed, and it's not supposed to be fresh, active blood. It's supposed to be pinkish discharge, or sort of like, as you see it in end of your period, kind of a bleeding. Another reason behind this spotting could be it's when now you've got imbalanced hormonal levels, wherein this now, like for example, the estrogen and the progesterone levels are not in sync. So that one tends to be associated with a lot of cramping. And that one can be quite severe, and it happens a lot in the first trimester of pregnancy. Let me talk about the severe form of bleeding in pregnancy. This now won't be spotting, it will be proper bleed. But remember, even the proper bleed starts with a little bit of spotting. In situations wherein now you are having hypertension in pregnancy and now you're having the condition that is called abruption, it will be proper bleeding. And by then you will be suspicious because there would have been talks about your blood pressure by your caregiver and all that. So should you happen to have bleeding when you're having high blood pressure in pregnancy, it is quite significant. Contact your medical professional immediately. Sometimes if you had a hectic fall and now you've got what is called an abruption, that means the placenta is peeling off from the womb area. That will be a significant type of a bleeding. And sometimes it could be what is called concealed bleeding, wherein you're seeing something like spotting. It's not a gush of blood, but usually you tend to have abdominal distension, cramping, and all those things. There are other symptoms that are associated with it. So any bleeding in second, third trimester, I always say to the moms, take note and contact somebody and call somebody. Now, how do I manage these bleeds? There is no management of bleeding, okay, by a mom. Okay, always put on a sanitary pad and observe so that when somebody is asking you about what is happening, you can manage to give a proper information and say, I'm wearing a sanitary towel. After wiping, when I went to the toilet, I'm wearing a sanitary towel, and there is a little bit of a bleeding even on the towel. And that means the bleeding is still carrying on. And sometimes the bleeding could be at the end of the pregnancy when we are expecting the show. Show is a sign that something is happening, the cervix is opening. That tends to be mucousy blood, and it precedes labor. You can have a show today and only go into labor or experience contractions or what we call surges or period pain kind of a sensation 2 or 3 days later. Okay, so when you see a little bit of blood, put on a pad, monitor and see, especially end of pregnancy, so that if now the gynae, the midwife is asking how frequent are the pains that you're getting and how is the bleeding and all that, at least you know how to give an information that is solid, that somebody who's not there with you can work with.